Good morning, ladies and gentlemen. Welcome to our show, Lifestyle with Dr. Mobi. I'm Dr. Mobi, and today we're going to discuss an important topic, and that is hearing loss. Just for audience, I just want to tell there are 38 million or more people suffering from hearing loss. So today we're going to learn a great deal about hearing loss from an expert, and he is board certified internist as well as in geriatric medicine. Let's welcome Dr. Jamil Ahmed. Dr. Jamil Ahmed, welcome you.
Thank you.
How are you doing?
Good.
Good. Okay, so tell us what is happening with hearing loss in US?
Well, as we get older and people are having a lot of chronic diseases, one is probably you can think of high blood pressure, degenerative joint disease, or knee pain and hip pain, and hearing loss is not far behind. And so I think it'll be important to talk about because sometimes we ignore hearing loss because it doesn't cause chest pain, it doesn't cause any pain or shortness of breath that will take you to the doctor's office. It comes very slowly and you almost adapt yourself to less hearing loss. We don't give enough importance to hearing loss that I will give to chest pain. That is normal.
Yeah, and that is a very important thing. A lot of people don't realize that, and they don't monitor their hearing deficit unless you have some loud noise and you were listening to that before and now you're not acting to that. So your speech can be affected. So for everyday work, we have conversation is at certain decibels, and which might not show that loss. So for audience to know is the hearing is actually measured in decibels. So it's a unit which they use to measure the actual flow of sound. But to distinguish the hearing loss, you could have high frequency, low frequency, mixed frequency, and it all depends on the range. Now, most of our conversations are in certain range, and then most might not have that loss. So it's very important to understand that hearing loss has a spectrum. So when we mean by is the hearing loss is not the same for one, so it could be in any frequency and still count as hearing loss, right?
Yes. If you think what predicts hearing loss, number one probably will be age. And if you could look at the numbers, that 25% people between 65 and 75 will have appreciable hearing loss. Over age 75, it is almost 50% people will have a hearing loss. In the United States, 38 million people have hearing loss problem. Of that, not too many people will get a hearing aid. Actually, 3.65 million people have a hearing aid, and they actually bought it. Mm-hmm. Of that number, 30% people will use hearing aid once in a while, and actually not at all. They are expensive machine that will sit in a drawer someplace for the rest of their life. So it is a disease that's misunderstood or underappreciated how it affects our body.
Okay, so tell us what are the most common things anybody would notice with hearing loss. So if they are a little more careful about their hearing loss, where do this usually manifest that?
They will miss out on words.
So
they will talk to people that makes not right. People know that you didn't get it, or you can ask, "Excuse me, can you tell me again?"
Can you tell me?
And sometimes your spouse will know more than anybody else that I'm talking to you, not listening to. That's also not a problem, but sometimes the frequency of female voice is that men cannot appreciate it because they lose high frequency sound. Like if you think that what causes your hearing loss, number one is age. And if you have a lot of family members who has hearing problem, you tend to inherit that.
Oh, so it's inherited.
Yes, you can have some inheritance. Another is like you don't see that anymore when people are working in a factory a lot, noisy environment, and almost 25% people who work in a factory are actually had hearing loss problem as they get older. There is a disease. Some diseases are very easy to cure, like a wax in your ear canal. That is probably more common than anything else. And you clean the wax and it gets better. Then you have a stroke or tumor. That can cause hearing loss. If you have a hearing loss in one ear, which is probably not good, sometimes that might tell you that you may have a condition called neuroma or a acoustic neuroma, which is a tumor that can affect your hearing in one ear, and you need to see a doctor immediately compared to something you can sit on. And there's an infection that a lot of kids gets all through their life, middle ear infection. At the end, some of them will have hearing issue, and we thought that is normal. It's not normal. Actually, it is happens more common than we think. And then brain injury, and also as a Meniere's disease. In those diseases, people will complain of ringing in the ear forever. And so if you have a ringing in the ear and it's not going on, and simple medicine is not helping, probably you need some extra investigation to find why you're having ringing in your ears. Then you think about medications. A lot of medication that we take every day can affect your hearing. They call ototoxic. It means it's toxic to our hearing. There's over 200 medicine that actually can cause ototoxicity. In medical life, we talk about bad medicine like a gentamicin, an IV antibiotics that's good for infection, but it can cause major issues with hearing, like a common medicine like tetracycline is a problem child. Other than that, if you have somebody getting chemotherapy or someone with a cancer and getting chemotherapy can do that. Common medicine like an aspirin, ibuprofen, naproxen, all can cause hearing problem.
Okay.
But you have to have a large amount of aspirin to do that. You have to take almost 6 grams. 6 grams is a lot,
Yeah, that's
it makes 3 pills makes 1 gram approximately. Then water pill or diuretics like Lasix.
Yeah, Lasix.
And the chlorothalidone like a tenoretic can affect your hearing. So if you have issue with the hearing, probably you can talk to your doctor and ask them, is it something else I can use? Because I already have a bad hearing. I don't want to make it any worse. Other antibiotic you can think of is probably vancomycin that we use a lot nowadays because of resistance to bacteria causing a lot of usual medication not effective anymore. So we give them vancomycin, and that's not good for hearing.
Yeah. So those are the most common. I mean, aspirin probably is, like you said, it's very common, but a lot of people don't know. So that can cause. So a lot of medication we should pay attention to. Lasix is also commonly used. It's a water pill. And also for audience, also acoustic neuroma. I remember this was a famous saying from one of our professor, ENT, is to say that's a condition where nobody sees everything and anything, and patient doesn't hear anything. So which is by definition, there are different parts of the ear. External ear, which we see, and then there is a middle ear, and which has your drum, and then there's the inner ear, which has your neurons, and they're transmitting to the brain and giving these signals, changing these mechanical signal into the electrical pulses, and that's what hearing is. So it is more complicated than what we think, and those are cells which neurons actually fire. They pick up different frequencies. So unfortunately, if you are listening to one frequency a lot, which is like if you really listen to high loud music, through the years, you cannot damage those very specific neurons. And then as a result, you will not hear those frequencies later on if it's damaged. So it's very important to understand that there's a spectrum to hearing, and then those are unfortunately permanent loss. So like Dr. Jamil was saying, one is ringing in the ear, which could be sign of hearing loss. It happens because these neurons are firing, misfiring, so they are kind of dying cells, and then that can cause a very common condition, tinnitus, and a lot of people know about that. So that manifests as some degree of hearing loss. So whenever we have that, we want to also check that your hearing is good. And so if you are exposed to loud noises, protect your ear, wear some protection, because that is very important, especially if you are into these hobbies, firing and so loud music. You should really protect your ears, because once you lose that, it's not going to come back. So also tell us about other effects it can have.
Well, on that thing, that I can give an example of Beethoven, or one of the great composer and musician. He lost his hearing. 2 years of his life, he was almost deaf.
Wow.
And he hated it. And every place he used to go, he says, that I never wanted. And the story goes this way, that two ways he lost his hearing. One is he had syphilis.
Oh.
So it's a disease can cause hearing loss.
Yeah.
And also, at that time, if you were rich and famous, you used to have a glazed plate to eat.
Oh.
And the glaze was done by lead.
Oh, okay.
And poor people never had a lead poisoning because they used to eat regular plate. Anytime you put acidic food in it, it will leach out all the lead from the plate, and they had lead poisoning. And also, he became depressed, he became alcoholic, and ultimately he died from cirrhosis of liver, and sad way.
Yeah, that is sad.
Story of the Helen Keller. He was deaf and he was blind. She was an amazing woman. In spite of that, she became very successful. Her saying, I can rephrase it, is that eyes takes your things from your life, but loss of hearing will take you from society and communication, your friends. So hearing loss impacted Helen Keller more than her blindness.
Wow.
So it is a social isolation. It is a loneliness, frustration, that they become depressed. And then recently there came out a study that says that the relation between hearing loss and dementia. People who has has a dementia because they could have sensory input. So we tell people to get a hearing aid or do something to make your hearing better, because it is not only for hearing, it is also for your mental sanity at the end.
Yeah.
And there is a strain in the families, social structure is decreased, friends don't want to talk to you because they don't want to yell at you all the time.
Yeah.
So it is problem. As we get aged, we all will have it somewhat.
Yeah.
We call it presbycusis, or it's a Greek word or a Latin for old and hearing. So it usually happens over age 60. Few things affects more. It's just because it's a high frequency sound, so you don't hear violin well. You can hear woman's voice as good as a man's voice. You don't hear bird chirping and the whistle. They don't also hear S in a word.
So the S part is...
S part, like a sun. They don't hear sun well.
They will do.
So you have to rephrase it some other things. That consonant like H, F, S is better that avoided so that they can understand better. And there's a lot of other thing goes on, like what has happened. So low frequency that is not much affected, so they do very well. Problem with the telephone, it is not that it is a high frequency. It is a middle frequency. It's no low frequency, no high frequency. They want to keep at the middle frequency, so they miss out some of the telephone conversation because of the way the sound comes to the wires. And just a thing I want to add that some of the animals can recreate nerve cells in the brain, like reptiles, birds, or a fish. They can regenerate cochlear cell. Human being cannot. So once you lose it, you lose it.
Yeah.
That's where the stem cell comes into play, because people think that if we can bring back those stem cells, you may gain back your hearing again. That will be a blessing to a lot of people.
Also, for audience to know is whenever in newborn we have to do a hearing test, and it is mandatory. So because their speech actually depends and development depends on normal hearing. So if there is especially hearing loss and there are a lot of infections, especially middle ear, they can have speech problem. So it is very important that because the brain growth, especially the language portion, will depend on the input of these neurons. And if these neurons are not firing, guess what will happen? You will not develop. And that is sad too. So if hearing loss in kids is totally different, but it is very important for their speech. For adults, of course, it's important. We have to be careful, especially in older age. The dementia risk goes up if you have hearing loss. So that's another thing we really need to pay attention to those. So any final thoughts?
Yes. When you see somebody and if you have a hearing loss problem, it will be good to tell them that, I have a hearing problem.
Oh, so it's just tell them. Okay.
Yes. In that way, they will try to slow down the way they talk, which word to speak. They will rephrase. So these will be strategy that you have to take so that you can function better. Worst thing is not to know, so other people not to know that you have a hearing problem. They will tell you something, then go away, and you have no idea what he said.
Oh, so
it is better to ask than just to tell that I heard you, because it's not going to be any good. It's going to be a problem. So in summary, if you want to do that, age, it is age related. Not much you can do about it. You can defer it slowly. Like if you don't smoke, you have less hearing loss. Alcohol is related with it. You have to avoid a medication that can cause hearing loss, and this is permanent. Presbycusis or hearing loss with the hearing is permanent. So you have to do everything possible not to lose that.
Yeah,
and there has been no vitamins, no food ever been associated with loss of hearing or making any better. So if you want to sell something, don't buy it, because it's not going to work.
Yeah, a lot of people with tinnitus, actually, a lot of products on the market are there to sell, and they claim that it's going to get it better. Please don't do that. You're going to just waste money. It's better to take care of your health otherwise.
There is a federal law in this hearing aid business. They said anybody can have a hearing aid for 30 days. It is federal law that you can try and give it back in 30 days, no question asked.
What is the law?
Law is that, you can return hearing aid in 30
days.
Oh,
30 days hearing aid. Okay.
In 30 days. So you can go to audiologist and ask them to check your hearing, and if you need a hearing aid, they will give you a hearing aid. If you do not like in 30 days, you can just return it. A lot of reasons that people don't like it, like it didn't fit well, there's too much background noise, and they can't function because the way they look. So these are things that most commonly used. So It is not a consumer device. It is a FDA approved equipment. So there is a different law for this. And nowadays, hearing aid has been very sophisticated. I always thought, why hearing aid will cost $5,000? It makes no sense to me. It is almost like a big computer in that little piece of equipment. Nowadays, they have a Bluetooth in it.
Wow.
You can have a telephone system built in it, so it will ring there.
Wow.
So it is another is that they're so small they can actually implant in your ear and stay there. And then you have to not cochlear, actually in the ear canal, store inside and stay there for. You don't have to bring it out for a long time. And of course, you avoid the medication that will make you lose more hearing than you need. And the future is stem cell.
Stem cell.
And one day we hope that there will be enough development so that and the older people will hear again. Like Beethoven says, when he died, he said, "I'm happy because when I go the other side, I will hear again."
Wow, that's very touching. So also, if you want to tell a little bit about cochlear implant, do they work?
Yes, they work. If your hearing aid doesn't work, cochlear implant is very successful, very helpful, and it is still looks like something sticking in your outside in the head. But if you hear well, you don't care how it looks. In future, it will be probably more smaller, or maybe plant under the skin in such a small that you will not even know that you have a implant.
Thank you for watching our show. This is Dr. Mobi checking out. But please remember to send me comments via Facebook, YouTube, whatever you like, email, website. We always love to hear from you, and also send us your questions always. Thank you.
Thank you.
Awesome.